We've gone through first the warm-up technique, then we went through the second technique, which is flexion. The third technique, which I'm going to show you, is by far the easiest. When I let him down, I set him down on the pillow. You're simply going to keep the arm resting on that pillow. I'm going to take his arm off of his stomach and bring him up here. You can see his arm is approximately 45 degrees from his body. Typically, what I would do is I would sit on this side of the table and gently push his arm back towards the table. In this instance, so that we can see the motion in the camera, I'm behind him. I typically would not be for this motion. It's easier and more comfortable to sit right next to the patient or to stand right next to them. But as you can see, I'm gently going back to neutral and rotating him back towards the table. The same principle applies as with flexion that we did earlier. You want to take him to 4 to 5 out of 10 pain, or where you feel a nice stop or a tension in the joint, a tightness in the joint where he's going to feel that pain. You're going to do this repeatedly, maybe 3 to 4 minutes before you stop and give him a rest. The other gentle stretch you can do out of this position, and I am in the position that I would normally be for this, is you can just gently go in the opposite direction. I'm going to do the exact opposite of what I just did. I'm going to push it down towards his belt, down towards the other side of the table. This is not a motion that is typically limited for these people post-rotator cuff repair. So it's easier for them and less painful, and frankly not as important. So I don't typically have patients spend as much time being stretched into this direction because it is not as limited in this position. As I alluded to in the previous clip, it's easier to have them just resting on the pillow, you sitting right next to them, and you can gently rotate them back using your right hand. You can also switch and push with the left. Rest your right hand on the shoulder to feel what's going on. Also, when you have your right hand on their shoulder joint, you can get a little better feeling of if they tense up. If they tense up, you're simply going to stop the motion until they relax, and then you're going to continue to push it into that tightness or pain that you're looking for.